Good day, my dear undergraduate and postgraduate students, and so also the faculty of various disciplines. I have been continuously learning from you people, and the topic for the day is small group teaching. Pedagogy by itself is a universe, and it is important from the exam point of view also because it carries nearly 100 marks. A smooth sea never made a skilled sailor, and we have been always living in a world of turbulence day in and day out. And I would like to thank Professor Sethuraman, who has been a genius in the medical education, from whom I have learned quite a lot. Coming to the SGT or the small group teaching, there are different methods or subdivisions of it, which include the group discussion, seminar, tutorial, demonstration, practical and bedside teaching, field work, workshop, and so on. The list is almost endless. Please follow this. The efforts and accuracy in implementing the small group teaching is more difficult than didactic lectures from learned faculty because this involves synchrony and precision, which has to be practiced throughout. The small groups provide the students an opportunity to practice the much needed social, emotional, and other learning skills. Small group teachers can also become more fluent with their intricacies. And the teacher gets a better feedback from the small group itself. Learners on their turn can be knowing better from their classmates. Small groups provide the students an opportunity to practice the much needed social, emotional learning skills. And the small group teachers can become more fluent with the intricacies. Teachers can get a feedback from the students, and the learners themselves come to know their classmates much better. The Bloom's taxonomy. Bloom is a pundit in education, particularly medical education. And this is an amazing circle that includes a lot of details, from which I have taken this square. Facts which we should impart to the student, concepts that he should understand, procedures that he should perform, and ultimately the knowledge with which he has to go. The outcomes of even a badly conducted small group teaching or discussion will be better than a good lecture. These are the words of Bloom, not mine. What are the administrative challenges in small group teaching? I am talking at the administrative level. It is a new modality of teaching. Only in the past 1 or 2 decades it has come into, and now it is full-fledged. Space has to be created for it. Teaching gadgets will have to be procured. And it has to be made acceptable to all students, teachers, and parents. A timetable has to be very precise so that it accommodates almost, it is like a synchronous rhythm. The number of faculty, people claim that more and more are needed, whereas it is more accuracy that is needed in carrying it out. And secondly, or the last, you find that this particular system does not match the mode of exam, the essay type of questions and so on. So, how are we to accommodate all this in the small group teaching in the prevailing circumstances? Which means, is this a beautiful lecture hall? I think well illuminated, and then the podium is there, the teacher is visible, can address the student, and so on. But is this practice on the wane, being replaced by the small group? And coming to the small group discussion itself, this is the beginning. I find that there is a facilitator or a teacher and there are multiple individuals. Look at the arrows, they are bimodal. To the teacher, back to the student. To the teacher and back to the student. This is one. At least the student has got an advantage of directly seeing and interacting. But then the definition is it should be about 5 to 20 and it has got a definite method and structure that has to be followed. Still, there can be some amount of democracy and informality in it. But a common target has to be achieved. Ideally, 10 to 12 is the number because more than that, it might lead to dilution. What are the advantages? Democratic. Even within the limited circumstances, each teacher has got his own modality of teaching and carrying it out. Learner activity, particularly, you find that the learners are pulled into the learning system, they contribute, and even they play with the classes. The learner knows his own potential, and there is a chance to revise the lectures. Always it is possible. Repetition is the mother of knowledge. I hope you people recognize this genius. There is a group leader or an instructor. I hope you are able to identify the person on the screen. Coming back to it, the small group teaching is not just meant for the college students or the medical college students or the schools and so on. You are obviously seeing there is many a thing that I can understand from this picture itself. So you find that the students themselves are interacting, some are observers, and the teacher is simply having an ultimate job satisfaction. But then he or she should be well prepared and fluent. The teacher should know each member and should be able to control and regulate the dynamics, plan for the entire class, and here is where experience matters. The progress. Compared with the previous picture, now I find that the facilitator or the teacher is stepping mildly aside, but is still present so that there is a sense of direction that can be given. But look at the arrows. There can be a second person who can be taking up the role and trying to do the work. But you find that arrows are going in all directions in the sense that the small group teaching has now created multiple teachers. The teacher withdraws and there is an interaction, there is a creation of a recorder over here, and even the silent and the shy members are pulled into it. And the dominating member is pulled to the opposite side under the scrutiny of the facilitator. The disadvantages. As I mentioned earlier, an optimum student-teacher ratio is needed. And we have to be well prepared. Inexperienced group is ineffective. Learners' aptitude varies also. They can be either too fast or too slow. It is up to us to press on the accelerator or the brake. And it is difficult to cover the subject if the time is prefixed. Here is where the very rigid system has to be a little flexible so as to accommodate change with the changing times. Leading the group. And from one of them, I find that one student probably has been given the lead. And when the students are not forthcoming, one student should be asked to lead the group. And the initiative can be subsequently passed on to the other students. And this itself is a virtual mode of dissection and it becomes a medium for learning. Regulating the group. This is where again the teacher is. There has to be an active participation, purposeful participation, and a face-to-face contact rather than eye-to-eye contact. And leading questions should be asked so as to pull the students into the group of learning. Other methods are there which we shall be discussing in group discussion. When people have too many choices, they make bad choices. So obviously we should be very careful with our choice. And this incidentally is a T group or a therapeutic method of small group teaching that is going on. Something is on the screen and the teachers and the students are all participating. The bus group, this is one. When there is a number of students, you find that they are divided into small groups and they are given a kind of a topic or an assignment and they themselves discuss. It can be between them or between the groups themselves, and you find that when the original group is too large, a very small group can be formed, and that is called the bus group. Here, only one theme can be discussed and they can come back and contribute to the rest of the class. The advantages, the attention is well maintained, but the disadvantages, it is again time consuming, has to be precise. Brainstorming, another method of it. So you find that it is again to the entire group itself, but a general theme is given. So in this, for example, the COVID and the infections, the war that is going on and its implications, the different disciplines, medicine and law, how do they contribute to pertaining to certain situations. The problem again can be time. It consumes a lot of time. We will not be able to regulate it, and organizing and maintaining the discipline is a little difficult. Syndicate. A syndicate is always a group, and then what are the outcomes of it? It is a larger and a longer group than the brainstorming. The session is little longer. It gives the information regarding, for example, waterborne diseases, a general national problem, the medical insurance, or a cardiac failure. So what happens here is there is a clinical teaching from which you can have knowledge, there can be building up of the attitude and the skills of the student. What are the challenges to the teachers itself? It is a novel method and covering the portions will be difficult. Synchronizing with other teachers, this is again one of the major problems. You find that there will be a difference in the frequency, the knowledge, and the volume of lessons taught. Managing the active students, motivating the slow students, and trying to accommodate the space and time. Ultimately, even the assessment becomes a problem. And compare this with the conventional small group teaching that has been going on during the anatomy dissection in the medieval period. And what are the challenges to the students? They are too close to the teachers. This can be an advantage, some can be having an inhibition, and therefore a kind of impartiality will have to be there. And it has to be a gradual one as well as it is very sensitive. Passive learners tend to be active or they have to be made active. They have to blend with the entire group. And there can be other weaknesses, such as a weakness in the language, or it can be psychological. The inhibition can be exposed, as a result of which the students don't participate. This has to be assessed by the teacher. And this is an excerpt from the small group or the T group study. A case study is over here, and then there are the multiple learning students. You find that there is a discussion, and the T means therapeutic. Something is being presented, what can be the mode of treatment, or each group can be given one particular theme. There has to be always a democracy. That is why I like didactic lectures a lot. But what happens is it promotes an engagement between the teacher, learner, and the content. The small group teaching. The teacher is over here, the learner, and the content, and constantly you find that there is an interaction and a reinforcing between these groups. But careful construction of the goals and the objectives should be made, put on paper, see that it is uniformly practiced. And it also helps in the revision. This happens in some departments already. The didactic lectures are again being revised in a short time by various faculty. But this has to be organized in a renowned center. And there have to be experts in each of the field to deliver it. There has to be hands-on training. Therefore, obviously, the group of students will be small and repetitive. And the theme itself has to be quite novel. The T group I have already been mentioning. In this, what will happen is there is an in-depth discussion. Difficult to organize because It is difficult to get experts in various topics in various fields at a particular time, and also for small groups. It is fit for a larger group, and it has to be organized so very well that the small group teaching is well maintained. Seminars again will be the same, but it can cater to a larger audience. The role play. There is something over here. I hope you people observe. In this case, it is not a doctor, but then you find that two children, they play the roles of the doctor and the savior or the observer, and something is going on. These can have immense impact on the observers or the students, provided it is played well and taken well. The tutorial method is also over there. It is again for groups of students, wherein there can be remembering, understanding, applying, analyzing, evaluating, and creating. This is the Miller's pyramid. And there is a higher order of thinking that can be ultimately promoted. So these are the details over here. And the result ultimately depends on the tutorial expert. The demonstration, something that we had seen earlier also. And this, for example, there is a case of an ascites and there is a shifting dullness, and this has been demonstrated. So this is quite useful to the students because the clinical skills are again on the wane. And so also in basic sciences like biochemistry, a simple test such as a Benedict's what? The urine sugar can be demonstrated. So the ultimate steps are forming, storming, norming, and performing. So there is an excitement in anticipation, and storming, the students feel more comfortable. Norming, they become more positive and active learners. And performing depends on the group's ability, and so also the tutors. Ambition is the first step to success. The second step is action. Courtesy handwrites. So this group is obviously not very small, but then this was the group that motivated entire anatomy, if not medicine. Vesalius performing a dissection. And what are your comments on this? So we find that there is a lot of this kind of interaction. People are seeing in different directions. Some are trying to discuss and teach the other. A lot of such activities are going on in the anatomy lesson of Dr. Willem. And what are the outcomes of the different methods of teaching? They are all given over here. And surprisingly, lecture has got only about 5% of carriage, so also reading about 10%. Lower down, you find group discussion has got 50%. And when you practice it, it becomes 75%. And when you start teaching others, that is exactly what I am doing. I am learning at my age. So these are million-dollar questions. Will the cases be available to all the units? That is the clinical cases. At the same time, for example, cirrhosis. Can the same patient be demonstrated to all the students? I don't think he'll be able to withstand it or tolerate it. Can the same doctor be available to teach all the students? Impossible. So how do we do it? For that, there has to be well carved out platform, and in that you find that the timetable or the plan is the key. Consistency will be the key, and these will have to be repeated. If cases are not available, then we will have to create artificial cases so that they are presented to the students, charts and other forms. And from a bedside learning itself, this again comes under the small group. You find that there are 100 things to teach and learn. So these are all given over here. The impact, the clinical skill, the attitude, identity of the doctor itself, how compassionate he is with the patient, bridging a gap between himself and the students, the ability, the availability. Being a good teacher is not enough. Is he available? The fluency of the language, down to earth with the students. The hand as a diagnostic aid. There are too many things, I will not be going into it. Starting from the tremor up to the pallor, the cyanosis and the clubbing, and so on it will go on. And thanks to this particular reference, the medical teacher. So many things are there in teaching, and it is not that one can become a teacher overnight. Frankly speaking, I know only 20% of teaching. And this is a good reference. Incidentally, you find that there is a bipolar method of teaching and learning that is going on. And what are the take-home messages? You need not be the most effective person to be the best teacher. And the teachers will have to be trained for each and every class so that they synchronize. And there has to be a synchrony amidst departments and units. That is what the National Medical Commission had tried. They wanted a synchrony across the entire country, but they are struggling with it. A lot of homework and groundwork will have to be done. The advantages are, it is indeed a very effective method of teaching, and the student-teacher relationship is continuously being built up. Thank you.